Hey guys, welcome back. This is Coach Mike in the Recovery Lab. We're here with Pro Kickboxer Wayne Barrett. We're going to work on some shoulder treatment today for a mild case of biceps tendonitis that he got while training. So hope you enjoy it.
I got a really mild case of a little bit of biceps tendonitis, mostly anterior shoulder related. Last time we went ahead and worked on his neck, his scalenus, his upper trap, because he's having some neck issues as well. So today we're going to concentrate mostly on the shoulder around that bicep tendon insertion as well. So I'm going to treat both the long head and the short head of his bicep, as well as his pec, and maybe even get a little bit just into those like his subclavius and pec minor and the surrounding insertions for that short head of his bicep tendon. So we're going to start with just some regular ART work through his pec and his bicep, and then kind of work from there. So I already kind of went ahead and I actually warmed him up with a moist heat pack. So I made sure to warm up his bicep and his just chest area in general. And you can see Wayne kind of has that little bit of that anterior scapular tilt kind of thing going on, which is really typical. You'll see this in a lot of fighters just because they're always in that closed off position, and that's the way they train. So for today, what we're going to do is just kind of concentrate on just creating some blood flow around this area and then just decompressing that attachment point for him.
You can see I'm just kind of pinning that structure down and then moving him through horizontal adduction. And then I'll kind of work into that subclavius insertion as well.
Okay, so now I worked through his pec and his subclavius, a little bit of his pec minor. I'm going to bring him, I try to keep my table so that his elbow's in front of that shoulder, kind of bring him a little bit more into that scapular plane. So I have him, obviously, like I said, really well supported on my lap. He's definitely got his elbow, if you can see, kind of above that shoulder. And from here, what I'm going to do is just kind of work both heads of his bicep, with a little bit of extension, elbow extension as well. How's that one, killer?
Try not to make him a move for the camera.
Yeah, I mean, listen, guys, this doesn't tickle for sure, especially, my fight sport athletes, bumps, bruises. These guys are beat up in training, so, discretion is key in terms of pressure. With these pro guys, I tend to have a little less mercy with them because our timelines are generally a little stricter. So we're going to get in here and kind of do the work we need to do. I don't know if you'll notice this, but I keep him, for these last few strokes, I've been keeping him in a pronated grip while his elbow is flexed. And then as I extend his elbow, I'm working him into supination. Okay, and that's going to bring that medial head of the bicep into a little bit more stretch, especially as I'm working it into full extension here. And he's got a pretty nice trigger point, towards the top here. So we're going to try to release that for him. Wayne's one of those guys, obviously really well defined musculature-wise, and you can see pretty easily as I work up this bicep tendon how that anterior deltoid just kind of slides out of the way, and that really exposes that bicipital groove where that tendon is kind of sitting in. That would be cool, the long head of his tendon. So I'm going to show you kind of a cool technique I'm going to do with the Graston next to kind of hit, both bicep tendon insertions as well as just creating some blood flow, around those anchor points on the head of the humerus. Okay. In terms of Graston, kind of the same idea, just working distal to proximal. I'm using this scanning tool. Yeah, I'm not doing that. So I'm just going to kind of lay him back into the external rotation, which at that end range, that kind of bites him a little bit sometimes. So I'm just going to kind of let him hang there comfortably. Again, you can see his elbow is, you know, well above his shoulder at this point, so he's in that good scapular plane. And then I'm just going to work into that bicep as well, into that pec rather. Sorry. Hold on one second, I'm just going to close it now. Now, one thing with these bicep issues, obviously depending on the sport you're dealing with, especially for a striker, obviously Wayne's a kickboxer, so, you know, anytime you're going to get any anterior translation of that humeral head, you know, when he throws like a cross or an uppercut especially, if he gets one in nice and tight, you know, that humeral head's going to want to slide forward, and when it does that, it's going to start to irritate these anterior structures, right? There's not an awful lot in the front of the shoulder in terms of, you know, soft tissue or musculature that's going to really prevent that anterior glide all that much. So what you end up having is all these passive restraints, especially your bicep tendon, becomes like that really, that only passive anchor to kind of prevent that anterior translation. So you pair that with kind of that closed off posture, that anterior scapular tilt. So, you know, this is kind of the recipe that you would see really for any athlete, whether you're a throwing athlete, like I said, a fight sport athlete, where you're going to see like some of that bicep tendon issue and irritation. You know, luckily for us, this is really a mild case, so we're really just kind of doing this more preventatively than anything else, just to help him, you know, get the most out of his training and obviously treat his pain to a certain extent. So what I'm going to do now is really get specific. Now that I've kind of done like the general surrounding tissue, right, I've done some Graston ART on both his pec minor, subclavius, and his bicep as well. Obviously even into this like anterior delt and this lateral deltoid as well. So what we're going to do now is I'm actually get real specific with kind of one of these smaller Graston instruments, and we're really going to put his shoulder in 3 positions to kind of expose different shoulder structures to the front. So, you know, in this neutral position, like I said, I can kind of slide. You can see I can kind of slide this anterior delt out of the way, and that's going to really expose his bicep tendon really well there, especially the you know, the long head of his bicep tendon that's attaching right to the glenoid. And then I'm going to work right up into that insertion point. And, you know, again, this doesn't tickle, you know, especially if you're inflamed already. So I'm in the mild to moderate end of the spectrum in terms of pressure, trying to keep that 30-degree angle. And I'm obviously going to treat him down in this direction. And I'm going to work up as well, and just to see if I feel any difference in the quality of the tissue, which for him, not so much. So the next thing I like to do is actually just kind of internally rotate him, okay? So now, you know, again, his shoulder's a little bit, you know, again, elbow above the shoulder. I'm internally rotating him, and I'm just going to kind of work in that same area as well. So you just got to be a little bit careful in terms of skin tolerance to especially any of the instrument-assisted stuff. You know, especially if you're going to be treating over the same area in multiple positions, that skin might come to threshold a little bit faster. Alright, so now we're just going to, same idea, now we're just going to bring him and lay him to this externally rotated position. And I really like to do this because this, you know, this actually puts that pec on a little bit of stretch, so it gives me a little bit more of a firm surface to work on. And it kind of also exposes some of those rotator cuff insertions as well on that humeral head. So then I'll start working in there, same spot, like medial to that anterior deltoid. And then in this position as well, I'll even get in there and do some cross friction just to create some blood flow. Doesn't feel the best, but you know, in terms of creating a better healing environment for this irritated tendon, definitely works really well. All right, let's go just bring you back up overhead. Perfect, just like that. Okay, so the last thing we're going to finish this up with is just because we evaluated Wayne before we came in. He does have some scapular dyskinesis where the shoulder blade really upwardly rotates very, very early, and he kind of gets that impingement feeling towards the top, especially in that bicep tendon gets pinched up under there. So I'm just going to really quickly just work on his Teres insertion as well as a little bit of his lat and his serratus. Just bring some blood flow to these areas and kind of open them up a bit more. It gives him more comfort overhead. Especially while he's training, in addition to his fight training. You know, for this, we can even go into like some of our more active techniques. Let's see if I can move the camera back. So I'm kind of just doing like a little bit of a pin and stretch here. You know, again, he's in that scapular plane, probably right at about 90 degrees of abduction here. I'm going to pin that Teres down, and I'm just going to gently range him into that overhead. Now, while I'm doing this, I'm kind of like almost preventing that shoulder blade from rotating upward. But at that end range there, I'm getting a nice little stretch when I kind of hold that distal point of the shoulder blade down. That can sometimes create that feeling of impingement in the top, but in terms of helping create some separation between that glenohumeral movement and that scapulothoracic movement, it's definitely one of my go-tos. And having him lay down like this, while it's not ideal on his back, it's more comfortable for him, and it allows me to move the shoulder and scapular plane a little bit easier than, let's say, if he was like sideline. Nice, okay, so now I'm just going to lay over. Now what I'm going to do is kind of just work that serratus a little bit as well. So what I like to do is just kind of generally like lube him up here. And, on Wayne specifically, obviously, because he's a fighter, he's definitely well developed in his serratus. So a little bit of work in here can definitely help his shoulder a great deal. So what I kind of do is just follow that groove of the ribs and just follow that nice and steadily along until it kind of disappears behind his shoulder blade. So I'll usually pair this with some sub-scap release. I try to use as many fingers as I can just to spread my pressure out. Okay, cool. Just going to follow this all up with a little bit of Graston again. I'll pick this one for this one, just because it's got a really nice contour. Oh yeah.
These were the ribs that were.
That's right. Oh yeah. That's crunchy in there.
Yeah.
All right. So we'll wipe them out. All right, Wayne, go ahead and sit on up for me, all right? All right, so on the corrective exercise end of things, especially after a treatment like this for biceps tendon, what I really like to do is more like the external rotation patterns, kind of work his posterior cuff so that it's preventing that anterior slide or that anterior translation of his humeral head. Again, you can see, in terms of just his postural alignment, even after I treated him, he's definitely got that kind of medially rotated shoulder thing going on again, from being in that that fight position. So he gets some upper trap tightness as well. So I'm going to work on his upper trap a little bit. That seems to help the shoulder for him as well. And then we're going to just do a quick RockTape application so that he can get the most out of his training today. So we're going to work together on this one. We're going to go rotate to the right and then chin straight down, okay?
Okay.
So we're going to same thing, rotate and then chin down. Good. Keep it coming. Nice. Just a few of those. Go ahead. Chin down. Good. A couple more. Chin down. And last one. Chin down. Nice. Rotate just like that. Perfect.
Awesome. Okay. Cool. So we're just gonna wipe him down now. We're gonna spray him off, and then I'm gonna prep the tape, and then we'll get that done. You feel all right?
Yeah, I feel good.
How's that feel now? You want to just kind of retest it a little better?
Much better.
Yeah.
Much better.
Right.
Yeah.
Okay, cool, awesome. So yeah, like I said, you know, let's work on some external rotation stuff.
Okay.
You know, I'll show you some band work when we're done, just as a way to kind of just get this stuff fired back up.
Yeah.
So once this starts to get real tight like this is going to get real inhibited. So we want to definitely make sure that we're pairing this manual treatment with some exercise. You know, so for this RockTape application, you know, obviously I just used a bunch of lotion on him, so we're gonna take the time to make sure that we clean him off real well. We're gonna kind of keep this to a really simple tape job today. You know, I'm just gonna give that bicep a little bit of help, as well as just kind of influence the shoulder into a little bit more retraction so it doesn't get as much kind of anterior translation. So today for him, you know, again, because he's training pretty rigorously right now, I'm gonna put a little bit more stretch on the tape than I normally would with one of my athletes, only because, you know, the level of training that he's doing. So in terms of the tape, you know, what I'm going to do here, just kind of measure this out around what I kind of want to do. So it's about there. I'm going to cut 2 of those like that. So I'm just going to fold this tape over right at that spot, and then cut it off right here. System strip right here. Okay, so what I'm going to have him do, now that we've kind of prepped this tape, I'm going to start with this bicep assisted strip. So I'm going to have Wayne kind of bring that shoulder into extension, right, and extend his wrist, right? So I almost want to put this on as much stretch as I can. And what that does is it kind of gives good contact with the skin, and it also makes the tape more effective. So if you can, it's not a painful position to be in. It's definitely recommended to put a little bit more stretch on the actual tissue and a little less stretch on the tape, okay? I'm actually going to give him a little bit of tension on this tape. So we're going to start it right at that kind of anchor point. You know, and I cut this tape long enough to kind of, so that's 0 tension, that's about 25. I'm going to give him about 50% tension on this tape up through over his bicep tendon. And just anchor it right at his AC joint. So for this, I'm actually going to leave him in this position. And the first one I'm going to do here is that anterior strip, okay? And again, the whole point here is to kind of help prevent that anterior translation. So you can just like tilt that back even more. Great, awesome. So using a little bit of thoracic extension. That's okay for the purposes because his shoulder looks in a really good spot. So I'm going to anchor this on his deltoid tuberosity. Again, I'm going to put about 50% tension on this tape as I lay it over the front of that shoulder. Oops. And then have it live kind of up in that upper trap insertion. Okay, we're going to bend this elbow, kind of bring him forward here. I'm going to finish this last one. This one's going to have really no stretch on it, more of like a rotator cuff assistive strip. Same idea, we're going to anchor this kind of on his deltoid tuberosity, and really with no tension, we're just going to lay this on, kind of anchor it right up there at the AC joint again. Okay, and relax. So, you know, there you have it, kind of. This is like a nice little kinesio taping application, specifically for a case of bicep tendonitis in a fighter. So we're going to obviously continue to monitor Wayne. We're going to do some rotator cuff work out in the gym. We're going to do some serratus activation, just kind of work on the kinematics of his shoulder blade movement. And then, but that's going to be it for us for today. So thanks for watching, guys, and we'll see you guys next time. Check out this guy on his next big fight in kickboxing. Thank you.